Hey guys, so this week we're kind of talking about micro, macro, meso level and at our internship. So this discussion board I felt like was a little more challenging for me, and I had to do a little more digging to kind of really understand it from my internship perspective. So for the micro level, I felt like specific activities that I practice at my internship would be, I do the individual brief intervention therapy, provide coping skills and mechanisms, mental health concerns, behavioral health concerns, behavior management, and working individually with the patients one-on-one. For meso, I feel like working with the families could be considered meso because I'm working with the family unit as a whole and it's more than one person. And I also feel like I work on a meso level by working with the community and communicating with other services that are in the community and other health providers. So I do a lot of phone calls and communicating back and forth with other services and referrals. So I feel like that's definitely a meso level practice of social work. Macro, I have helped look into insurance policies and what services my patients and their families have access to. So some of my patients we have wanted to send somewhere, and we realized that they wouldn't be able to get the help that they needed from that agency because they don't take their insurance. So I've done a lot of that, and as well just generally advocating for child mental health concerns and behavioral health treatment at the hospital or at the internship with the doctors, and the doctors tend to really advocate as well. So some methods I use to help resolve client problems: generally the patients will come in with a concern, either regarding behavior or mental health issue, and they see the provider. And the provider will refer them to me, and then I see them. And then I assess and I do some screening tools, and then I'll meet with them kind of one-on-one or with the family or both. And then I do some brief sessions. The way the BHIP program allows it is you can do about 6 to 8 sessions with each client. And then after that, if they still want to continue treatment, I would refer them out elsewhere. So that's kind of our method of solving clients' problems. It's kind of more brief and solution focused, and more about coping skills and education, but there is a therapeutic component, and I definitely try to utilize that as well. So some models of assessment: I use screening tools and I ask questions regarding the presenting problem, as well as getting a history on the patient. So interventions are brief, usually about 6 sessions for 45 minutes each, and then to evaluate, I usually ask the patient for feedback about halfway through, so third session. What have you learned? What do you want to continue to get out of the next 3? Has this been helpful? Has it not been helpful? And then for terminating, I provide them with a survey, which is used for the BHIP statistics. But then I review the survey after, so I give them to them, and they give it to the front anonymously, and then I'll review them on my own to kind of see what the patients liked from my services, what they didn't like, what they would like to see improved, and I feel like that's a really good evaluation tool. And then I also like to, ask during termination, what did you get out of this? Was this what you expected? Stuff like that. So then for discussing the level of practice that you prefer to engage in, I definitely prefer working on the micro level. I've recently started to enjoy more of the community involvement and community outreach side, but I like working individually and with groups. So in my opinion, I think the micro level has the greatest impact on my patients because they're children and they're so vulnerable. So I think it's important to focus individually on the needs of these children and youth, and I think micro level just has that impact on them, especially when most of them aren't seeking help because their family doesn't want them to. So their personal issues aren't being fixed or worked with or focused on because their parents can't get them to or don't want them to or won't admit that they have issues. So I feel like even though meso and macro has a lot more barriers for these patients and their families tend to be a barrier that I think, in my opinion, is a little more impactful, which is why I feel like the micro level is most impactful for the patients that I'm working with. So some relevant skills that we use at each level. So I think on the micro level, it's important to have effective skills like rapport building, building trust, communicating, assessing, interviewing skills, confidence, being genuine, empathetic, active listening skills, knowing how to use appropriate silence, being culturally competent or culturally aware, being good with people. So on the micro level, I feel like I'm very, very good at rapport building and building trust with patients. I feel like at both this placement and my placement last year, I was very good at doing that. And I think I have good communication skills, and I'm a good active listener. I think areas of growth, though, could probably be my interviewing skills, because I didn't get much experience with that last year, and I'm kind of just doing it on my own this year, so I would like some improvement there. And cultural competence. I think I'm culturally aware, but I feel like there's so much more room for growth. On the meso level, I think important skills include mediating, communication, friendly, organized, confident, and being informed. I think these skills that I practice are being friendly in the communication. I think I need to grow in mediation skills and confidence. I feel more confident on the micro level than I do on the macro or on the meso level, and I think this is something that improves with experience. On the macro level, some skills I think would be communication skills, advocacy skills, the ability to inform, having passion, lobbying skills, understanding of what macro level work is, legal knowledge, awareness of the justice system. I think macro-wise, I have good advocacy skills, communication skills, passion, and awareness and understanding of, injustices. But I think I could grow more on understanding macro level as a whole and how to inform people about the macro issues and the legal knowledge. So, finally, on to the last part. I feel like this discussion has a lot of components to it, and I want to make sure I hit every part, so I'm sorry I'm going over the time limit here. But the organizational goals of my agency are achieved at each practice level because the providers and I work one-on-one with the patients and the families on a micro level. And then we all work with other agencies and providers and resources. On the macro level, the providers go to conferences, and many of the providers advocate for improving children's mental health and their physical health. So since I'm at a doctor's office, much of their goals are more physical health focused, but they have a huge love and respect for the BHIP program, and they advocate for mental health and behavioral health management. And I've witnessed many of them fight for these kids the way a social worker would. They go above and beyond to make sure they're cared for, receiving the help they need, deserve. I really think that they help and advocate for their population at all three levels, both indirectly and directly. So, for example, the one doctor, she goes to the CAC once a week, and she works there for them and works with them for the children, and she does like her doctor stuff, but there. And I thought that was really cool to learn about them from this practice. So they definitely go above and beyond, and as a social work student, it makes me really proud that I got to be placed at this doctor's office, and I get to work with some really amazing people who help me advocate for child mental health and who have really helped me be able to see how prevalent and intense this issue is in our community. So I'm done now.